Hello. Thank you for joining us for this week's Rise and Thrive with EHE Health, an interactive series where we discuss all things health together. I'm sorry, we were having some technical difficulties. Unfortunately, we were not able to record this live on Facebook. So there is a Zoom link that you'll be able to click on Facebook, I believe, that will bring you into the program. So again, I'm sorry for the technical difficulties, but thank you for joining us. I'm Dr. Andrew Becker, a physician at EHE Health in Morristown, New Jersey. June is Men's Health Month. So for today's episode, we're joined by certified personal trainer Michael Ashford of Fit Dad Fitness. We'll be talking about some of the unique health challenges men face and how diet and exercise can make a huge difference. Welcome, Michael. Come on up.
Thank you so much, Dr. Becker. Appreciate being here. I'm based in Denver, Colorado, and so happy to be here. And like you said, have been doing Fit Dad Fitness for about 5 years now, and been a personal trainer for about the same amount of time, and excited about the conversation today. Thank you for having me.
Me as well. Thank you for joining us. Thank you for taking the time.
Yeah.
Before we get started, I should say that if anybody has any questions, please put them in the comment section and we'll do our best to answer them. So let's just get right into it then, Michael. I think, obviously what we're looking at here in terms of men's health, it's prevention. I mean, that's key for both men and women's health. We both men and women suffer from the same disease processes, but men, there are some distinctions that men have in terms of the way they approach their health and the disease processes, their risk factors, and what is unique in terms of their health risks. Again, prevention is key. Has been what's demonstrated that probably the clearest for us right now is the pandemic, the COVID-19 pandemic. So with this pandemic, I think what it's done is amplify the importance of preventive medicine, prevention, and risk reduction through diet and exercise and stress management, what we refer to as lifestyle modification, which is really the cornerstone of how we practice medicine here at EHE. It's how we think, how we eat, how we move. Again, it's been amplified by this pandemic because obviously those who have the highest risk factors, we've seen, unfortunately, that they suffer the most severe consequences from the pandemic, health-wise, increased mortality, morbidity, increased overall illness, increased numbers of those who have these disease processes are being affected and infected by the virus. Michael, during these times, how have you been able to motivate your clients to stay active and healthy?
Dr. Becker, I've said during this entire time that my greatest fear for people here in the United States is the fact that for so long we have paid so little attention as a collective to our health and to preventative measures and to living that lifestyle that sets you up for better outcomes. 66%, 67% of the US population is considered overweight or obese, and all of the complications that come with being overweight or obese are the risk factors that are involved in the severity of this particular virus. So if the risk factors of being overweight or obese aren't causing you to ail, if you come down with this virus, it can be exacerbated by that. Yes. And so that has been a big fear of mine. I think we're seeing that play out in a lot of areas, and certainly healthy individuals are getting this as well. I had it. I had this disease or this virus, but my symptomatic period was only about 36 hours long, and it wasn't as severe. It wasn't severe enough for me to go to the hospital. I just slept it off and took care of myself during that time. And So when we look at during this time how to motivate people to stay healthy, I think there is sort of a groundswell happening of people wanting to take a look at their health and saying, how can I set myself up as best as I can? For me as an online personal trainer and coach during this time, another thing that has been at the forefront for me and what I'm trying to work with a lot of people through is gyms, fitness centers, they're all closing down, right? What I think a lot of people are realizing is going to the gym and just jumping on a bunch of machines for your workout, when that's taken away from you, it really underscores the importance of good programming when it comes to your exercise and making sure that you're doing the right moves for the goals that you have for your body and your any underlying conditions that you have, rather than exercise being some mindless activity that you do,
Mhm.
that it becomes something that you're doing with intentionality.
Hmm. Oh, that's great. That's great. That's makes sense to me. In terms of, getting back to the differences in terms of men's versus women's health risk factors. I think one big risk factor for men that's been shown through studies, and the studies that I'm going to reference are studies from the Cleveland Clinic, Mayo Clinic, Harvard, the CDC. Basically, one big risk factor for men is that they just do not go to the doctor.
Yeah.
They just do not like to go to the doctor. They don't like to get physicals or checkups. They do not like to get vaccinations. It's been shown in studies multiple times. In fact, there was a study through the Cleveland Clinic. They actually did a study on this where they basically said they came to the conclusion, the result was 72% of men that they studied would rather do household chores, including cleaning the bathroom, rather than see the doctor. So that says a lot to me. But, in all seriousness, there does seem to be, there's a stigma that has been perpetrated, at least perpetuated rather, throughout the decades, that really seems to cause men to go to or attend to their health and wellness issues less than women. And it seems almost like some of these studies suggest basically it's almost like passed from father to son, that it's not wanting to appear less masculine, not wanting to appear weak, because, that was the societal view of men in terms of being the, provider. Whereas now really that's not the case anymore. We live in a time when both men and women, both parents are the providers, but still, it seems like the stigma is perpetuated by different societal views. Men seem to perpetuate it amongst themselves, between their friends. And, I think a good way of, in trying to break that cycle is for men to say to their friends, I'm going to go to the doctor and get checked out and make sure I'm okay because I want to be there for my family. I want to make sure that I'm still able to provide for my family and be there. So it's trying to break that stigma that seems to be so ingrained in men's thinking. And again, that seems to be at least a conclusion of a lot of these studies.
It's true. And my business and my personal training is mostly focused on fathers. It's dad fitness, right?
Right.
And what we see in the father community especially is it's almost made a joke, the dad bod. We hear the term the dad bod thrown around, and it's seen as a joke, and it's not taken seriously. I don't know how many times I was told when I first became a father, like, get ready for, your health and your body to go downhill. And the dad bod is characterized by that large midsection. Men tend to carry their weight around their midsection. And that can be a sign of a lot of different underlying complications or exacerbate other complications as well.
Absolutely.
And it's seen as a joke, like, I'm rocking my dad bod. And it is a very serious thing. And that mentality can end up killing us.
Yes.
And I often characterize a lot of that mentality as the dad's noble cause.
Hmm.
that I'm working so hard to take care of my family and provide for my family and focus on them and their needs, that I just simply don't have time to take care of myself. And on the surface, yeah, that sounds right. It sounds like you're doing it. You're being the dad, you're doing that thing. But I always pose the question, what good is quote unquote killing yourself for 20 years if by the age of 55 you die of a heart attack,
Yeah.
or you perhaps lose a limb from diabetes, or any other cardiovascular or musculature impairment, or what's the right word?
Ailment or
Ailment. That's right.
exactly.
Ailment.
Yeah,
What
I know
good
what
is
you
it?
meant.
You're not going to reap the benefits of working so hard if you pass
Yeah,
away at a young age
yeah,
because of the things that you could have prevented had you paid attention to your health, had you paid attention to how you fed your body, and spent time working on yourself, and not excusing those things through, as I mentioned, the dad's noble cause and making light of the dad bod.
yeah. Those are excellent points. I mean, you're absolutely right. And again, getting back into that resistance that men have sometimes, it's no more apparent than in the area of mental health.
For sure.
Men, and I'm sure you deal with this with your clients in some aspect as well.
Mhm.
The stigma is the worst for mental or emotional health. Men are brought up not to discuss their feelings. Sometimes, the classical or traditional father to son, don't talk about emotional health, don't talk about feeling down or sad or depressed or suicidal. These are all things, and the studies unfortunately really portend some very, very bad numbers. They basically suggest that men are at the highest risk for actually dying by suicide.
Yeah.
They also they don't reach out for help. The studies suggest they don't reach out for help, and when they do reach out for help with a mental health professional or mental health services, they are the least compliant with their treatment. And again, something that this pandemic has made very clear is mental health issues and emotional health issues in the world, not just this country, but in the world, including something called post-pandemic stress disorder. These are real entities that we're seeing. And again, men also present differently in terms of depression, in terms of their symptoms. Studies have indicated that really men present more with fatigue, irritability, anger. At EHE, we have screens for these things. We have anger screens, we have PTSD screens. So again, it's another area where there's a huge difference between how men and women present and how they attend to their wellness and how they seek health and how they seek out help. Oh, sorry about that. Sorry, you lost me first. Sorry about that.
You were getting excited.
Yeah, I was actually. Thank you. So basically, talking about health, what are the top causes of death for men? According to the CDC, the top causes for death in men in the United States are heart disease, cancer, and when we talk about cancer, lung and prostate are number 1 and 2, colorectal is number 3, unintentional injury, chronic lower respiratory tract disease, stroke. The reason I bring this up is, one, again, these are all disease states that men and women, except for certain illnesses, men and women both share the same risk, the same disease processes. But the issue is that these all, if not all of them, can be prevented by lifestyle modification.
Yeah.
And that's the key here. Again, it's lifestyle modification, it's diet, it's exercise, it's stress management. So it's really, it's really things that need to be addressed and that men need to address more. And it seems the studies are suggesting men are addressing these more. They're talking about these issues more, but not nearly enough. Michael, when you evaluate health concerns, when you bring on new clients, how do you do that? What's your process? How do you analyze and tailor workout plans for clients with illnesses?
One of the first things that I do is I get them on a call, like a Zoom call or a FaceTime, and I just walk through what's your history. How have you exercised in the past? What have those results been? What did you like and you didn't like? And then what do I need to know about you physically, about you mentally, that is going to either enhance or impede the work that we're trying to do? I need to know past health concerns or health issues, surgeries, diseases, ailments that you may be currently fighting right now, any prescriptions that you have that may affect, heartbeat and how your blood flows through your body. Some medications can give you can cause that to be a stress point during exercise. So I'm asking all of that full health history when I bring somebody on, because I want to make sure that I'm not doing anything detrimental certainly in the immediate to anything that they're currently going through or have gone through in the past. But on the topic of the mental health side of things that I think is so crucially important, I also have the conversation with them that, look, this is to, yes, achieve some sort of physical health within your body. We're doing this because we want to build muscle. We want to lean out and drop body fat percentage. But the bigger goal out of all of that is we want to feel better. We want to be able to move better. And so I try to divert their attention away from measurements or a number on a scale or what their body fat test says. Those things will all come with time. If we just focus on feeling better and accomplishing something and being consistent with it. If you think about learning any new skill, and I often talk to my clients that we're going to the gym and we're working and exercising to train our bodies to get better at a skill. And when we do that, if we think about any other skill that we've tried to learn in our lives, let's take playing the piano. When you have finally learned how to play that first song and you play it and it sounds great and you didn't make any mistakes, how does that feel to you? You feel accomplished, you feel confident, you feel more capable in your abilities. And exercise is the same way. Going into the gym and let's use the deadlift as an example. That's a highly technical move. But if you train your body and you go into the gym wanting to get better at that movement, the other results will come. Same with running. Too many people think that you can just throw on a pair of running shoes and go out and run.
Yeah.
Well, running is a skill. I used to be an endurance and long distance runner. Running is a skill that needs to be trained to prevent injury, to prevent burnout, to prevent any sort of fatigue. Like, we've got to change the way we mentally approach our health and fitness as much as we change the way we physically change our bodies.
I think that's a great way of putting it, in terms of talking about this as a skill. I really like that because, there was a study done from the University of Maryland that actually found that men, talking in terms of mental health, emotional health, they don't look for traditional talk therapy. They don't look for more conventional approaches. They rather look for non-traditional treatments like physical activity. They look for exercise, hobbies. These are ways that men look to try to deal with some of their feelings in terms of emotional, situational depression, anxiety, panic.
Yeah.
And I think that's a great way of putting it, is this is a skill that you can build on.
Yes.
So I really like that a lot. Again, some of the health risks and risk factors men should be screened for, basically. We look at things like prostate and testicular cancer, men's sexual health. Again, there are many studies that indicate erectile dysfunction. Men do not feel comfortable talking about this with their doctors. They don't feel talking about it with anybody. But there's a study that had really showed that erectile dysfunction can sometimes be the first and only symptom of underlying cardiovascular disease. So heart disease, hypertension, high cholesterol, colon cancer, diabetes, chronic respiratory diseases, sexually transmitted infections, alcohol and tobacco use, depression, suicidality, emotional health. I mean, again, I know these all sound familiar to you. You've been talking
Yeah.
about how you approach them with your clientele. How often do you see most of these risks and health risks among your clients?
You know, I haven't had a lot of those really acute health risks. Most of the things that I'm seeing are either, hey, I hear this a lot. My father passed away at age 65 from cardiovascular disease, and my 60th birthday is coming up. So that means I'm 5 years away. I need to make a change. So there's a lot of, we see the example and that jolts something within us. I also see a lot of mobility issues, that I can't lift my arm above my shoulder. I
Mhm.
can't get into a deep squat, or I can't get down onto the floor to play with my kids. And being immobile is another cause of what's causing us to be an overweight and obese society. We're just not moving enough. We're just not getting in enough activity throughout the day that is not part of an exercise routine. We're sitting in our cars, we're sitting on the couch, we're sitting at our computers, and we're not paying attention to moving our bodies and being functional. And so
Yeah.
that's a lot of what I deal with. You've got maybe I'll say the pressure of family history weighing down on a lot of men.
Yep.
And then you also have the realization that, especially with fathers, I want to be able to move my body and
Yep.
keep up with my kids.
Right. Right. Yeah. That's excellent point. Excellent point. I mean, you're absolutely right. Immobility, Harvard Medical School, through a study they did, they found their population of male patients, the average man was more likely to drink more alcohol, to use more tobacco products, make more risky choices, unhealthy behaviors, not see a doctor for regular checkups. So again, there's this uniqueness to men, how they approach their health and wellness compared to how women approach their health and wellness. And one of the thoughts behind that is also that women actually are introduced into wellness sooner than men. For example, when they go for, say, their gynecology, their gynecologic care, that's usually started at an earlier age than men tend to go to the doctor. So they've already been introduced into the healthcare system earlier than men. And so that's one thought as to what might be an issue in terms of men accessing healthcare sooner than women. But again, everything you're talking about, really hits home. And I really think that, again, these are all risk factors we have to address for men and women, and how to get men going to the doctor, get them going to the gym, healthy diet, weight, exercise, stress management, smoking cessation, and limiting alcohol. If you take those risk factors, just those, you've pretty much hit almost every disease process that men and women face. It's again, it just happens to differ in how men, their risk factors for some of these are much larger because of the lack of wanting to go and seek care for this, and again, risky behavior.
And to add to that, I always frame it as this: like, look, it may take some work in the immediate upfront to go away from habits that are well established. You may have habits that your lifestyle habits, your eating habits, your movement habits that have been established for years. It may take some time and hard work up front. It will take hard work up front. But for me, I always frame it as this: I never want my body to be the limiting factor for me experiencing life with my family and life with those that I love. And I want for as long as I possibly can affect, I want to make sure that I'm setting myself up to experience life. And when you look at it that way, I think a lot of men begin to connect with that. We think about the experiences that we want to have, either, I'll say selfishly or with our family. And we start to think, can I do that at age 65 or 70? Can I walk my daughter down the aisle and feel confident in my ability to stand there? Can I hold my grandkids and feel confident in my ability to hold them in my arms? Can I go on a vacation in retirement with my wife and do everything that we want to do? When we start to look at it through the lens of longevity and a lifetime of experience, I think men begin to connect with that much, much more so, and begin to accept the fact that there's going to be some heavy work, some heavy lifting, pun intended, up front
Right.
to
No, that's good.
to to replace the habits that are not as productive with those that are, and set you up for a lifetime of health and wellness.
No, excellent. Excellent. I know we're running a little over time, but
Yeah.
one last question. If the average dad wants to start taking better care of himself, and dad in quotes, the average dad wants to take care of himself with diet and exercise, what are some good ways to start, would you say, Michael?
I'll say this, and I'll try to be brief here. Eat real food. On the nutrition side, eat food that is as close to its natural form as possible, and as much as you can, move away from the overly processed, prepackaged, boxed foods. You often hear it referred to as shop on the outside ring of the grocery store. The lean meats, vegetables, fruits, the dairy products, if you're not intolerant to those, whole grains like quinoa and brown rice and sweet potatoes. Eat real food, and I think you'll feel a massive difference there. When it comes to exercising, I think a lot of men have this all or nothing mindset, and we think, well, if I'm going to exercise, I got to go to the gym. To get any results, I got to go to the gym and work out 6 days a week and kill myself on the cardio machine to lose 15 pounds. No, you can get great results by doing 3 workouts a week, total body, focusing on resistance training and building your muscle, and which builds your metabolism and kind of supercharges your body. It allows you to drop fat at the same time, and focus on heavy compound lifts, focusing on those lifts that get you the most bang for your buck: squats, bench presses, overhead presses, rowing motions that can really produce a big muscle building signal to your body in the most effective way. I think if and understand that you don't have to kill yourself to accomplish the results that I think most men want to, and quite honestly need to accomplish those 2 things in particular. And then be patient and understand that, to go back to what I said earlier about training your body, use your time in the gym and working on your health and fitness as a way to train your body, and you'll be much more able to handle the plateaus, the setbacks, the periods where you're not quite getting the results on the scale that you want. Be patient in that, and kind of reframe your mindset about exercise and fitness, and that'll be much more sustainable for you.
That's great. That's exactly what we talk about here at EHE. Like whole food, plant-based diet. Everything you said is exactly in line with what we try to promote. And again, lifestyle modification, it's prevention. That is the key, and that is the hope of how we get both men and women to, hopefully get to their optimal health. And just a quick shout out as well to what program we have here at EHE, the Health Mentorship Program. They cover all of these things. They help with stress management. They help in terms of weight management, fitness, nutrition. So it's a valuable service. I recommend all our patients should utilize them. They're great. In conclusion, I guess we went over a little bit, but we do have some time, I think, for some questions. We have, let's see, one question. What are some of the questions my trainer should be asking me before we start working out? I'll throw that over to you, Michael.
Aside from the things that I mentioned earlier, so asking you about your health history and your level of activity in the past, and what your experience with exercise and health has been like, and what your sleep has been like, and do you take any medications? Besides those questions, I think a question that has to be asked is, what is the absolute minimum that you can commit to working out and exercising each week? And the reason I say that is because, again, going back to what I mentioned earlier, we have this mentality that to get results, we have to do everything right now. As men, we just default there, right?
Yep.
But we often find out that that very quickly becomes unsustainable because of all the other commitments and responsibilities that we have. And I specifically talk to dads a lot in this area. You have your kids, you have your job, you have other hobbies and interests, you have so many different commitments and responsibilities. So what is the minimum that you could commit to? And let's sustain that. And yes, do I think somebody can get more or faster results if they go into the gym 4 days a week versus 1 day a week? Absolutely. But it's not going to get you results if you can't sustain it. So your trainer should be asking you, when we start, what's our baseline? What is the absolute floor that you can commit to, that we know each week this is what we're doing? And if it builds over time, and it will, I promise it will build over time, then that's great. And we can adjust and we can work around priorities and schedules at that point. But if your trainer's not asking you, what is the floor of your commitment level, then chances are it's not going to be sustainable for you, at least in the immediate.
Okay. Good answer. Good answer. Let's see if there's anybody else out there. It does not look like there's anybody else out there. So I think at this point, I think it's safe for us to conclude. Michael, again, I want to thank you so much for taking the time out of your busy schedule to help
Absolutely.
us out here and talk with us at EHE, and for our patients and for everybody who's listening to this. I think you made some excellent points, and really a good program that you also have, your blog. If you want to shout that out, you can, by all means.
Yeah, fitdadfitness.com is the website. And also I have my passion project is the Fit Dad Fitness podcast. So definitely go check that out on all the podcast players. But the hub of everything is fitdadfitness.com.
That's great. And it's good. I like some of the blogs I listen to on your show. So
thank you.
I can attest to that. All right. So thank you everybody for joining us. Hopefully everybody enjoyed this as much as I did. I know I did, and I hope Michael did too.
Yes.
Rise and Thrive will be back after July 4th. We hope everyone has a safe and healthy holiday. Stay safe out there, and thank you for joining us. Take care.